Hello everyone, my name is Tola Makinde and today I will be sharing with you on the topic caring for children with Down syndrome, the Nigerian reality. Hmm. Well, that doesn't sound off, right? But let me start by saying that Down syndrome is not a disease. It's not the end of life. It's not a curse, and it's only caused by an error in cell division during meiosis. And there are different types of Down syndrome, different types of Down syndrome, and this doesn't limit it doesn't mean that it will limit the person's capability or ability to thrive or to live a normal life. The Nigerian reality. Come to think of it, I used to think that having a child with Down syndrome in Nigeria, it's something that, shouldn't have happened to me. Like from my experience, the only thing I could remember was the worst case scenarios doctors told me and how they were so afraid and were sneaking around my baby's bedside at birth, not knowing how to tell me about the diagnosis. And then I sneaked up to the folder and saw what the doctor had written. They wrote something like suggestive of Down syndrome, and they talked about the facial appearances and all of those features you have when it comes to when you have a child with Down syndrome. In Nigeria, a lot of times we feel that having a child with disability is a taboo, and that doesn't really make life meaningful for even the mother and the child from the very beginning. From the very beginning, there is no love, there is no support, there is no care, there is no intervention. You don't have social workers around you that can just, pick up the case and provide a form of education for you to be able to, have a form of little hope for a better future for your child. Guess what? Persons with Down syndrome can do amazing things, can live their dreams, and these dreams don't have to be too tall, like the dream of just becoming an individual that can add value to the community, to his or her community, is a dream. That someone can see you and even respect the fact that you're, first of all, a human being, makes you feel happy, isn't it? I'll quickly throw some light into the first things you should be able to check when you have a child with Down syndrome. Well, sometimes we see them as health challenges, which of course they're like checklists for like annual checks for you to be able to just help the child with Down syndrome live and life optimally. So we have various you all know, you can read about the features of people with Down syndrome. There are over 50 features, but for every child born with Down syndrome, they would present at least 5 features, which I'm going to mention. At least the doctor will be able to see the low set ears, the slanted eyes. Sometimes they see the one crease on the palm. It's called the palmar crease. Then you have the the hypotonia, which is very common with children with Down syndrome, and that means that the body, the muscle tone is very, very weak, and the child is regarded as very floppy, sometimes described as floppy as a rag doll, that the hands are just everywhere, the body, the legs, even the neck. So we have definitely developmental milestone delays, and they could present in various forms, from not walking at the right time or sitting, crawling, and ultimately speech, which everybody would like, their children to communicate. Imagine that you cannot communicate. It will be so frustrating. That's why we have sign languages for even the deaf and the dumb, and it makes their lives easier. Then in Nigeria, like I said, it's not easily diagnosed. Your child's hearing problems are not easily diagnosed at birth, And it is a sad reality that you get to the hospital, you have a baby with Down syndrome, and a doctor, the pediatrician, or they don't have facilities in that hospital to diagnose your baby. If your baby has hearing defects or has a hole in the heart, some of the cardiac issues related to Down syndrome, you will definitely have to be referred to be able to get that done. And sometimes they're not affordable. Healthcare is kind of very expensive, especially when it comes to children with Down syndrome. Yeah, they are very prone to hearing problems, hearing impairment that can lead to deafness. And this just means sometimes, they are predisposed to what you call the glue ear. And glue ear is middle ear infection. This just about 50% of children would have, according to research, significant hearing impairment. Then, well, this ranges from mild to profound. Then we have dental issues, which some of them will need to, you need to get to the dentist to check. That is another checkup for the child, because sometimes they would have teeth not growing accordingly. And of course, you need your teeth as part of the articulators for speech. There are different articulators that can enhance speech and promote speech and sound for every one of us, including my abdominal muscles. As I'm speaking, I'm feeling some form of contraction and release, and all through my larynx, my throat, and all this, including the tongue and teeth, are part of articulators for speech. But in Nigeria, we have very few people that understand the anatomy, like the oral anatomy. Like, even if you look at just the skull or the head alone, there are different things going on for a child with Down syndrome. They have the broad neck, like sometimes we call it the web neck. They have the low set ears. They have the shape of the skull is kind of different. Sometimes they're being referred to as having the brachycephalic type of head shape, like the skull shape. And all of this too would add to the could add to the problems that have to do with enlarged adenoids. Like, for instance, a child that has Down syndrome would have the mid-facial bone flatter on the developed mid-facial bone. So it's kind of flatter. Then you have behind the nose, you have a lot of things going on there. Then, so a child with Down syndrome needs regular checkups. And trust me, if these checkups are done and they are fine, they are unstoppable. They can live life normally. The only thing I've discovered is the care for them. I mean, it's something that should be covered by the government. Like, we should have easy access to health checks. All of those things I've mentioned. So seeing the ophthalmologist, seeing the audiologist, the ENT doctor, seeing the dentist, the cardiologist, because over 50% of them also have heart diseases. Then when you want to talk about intestinal issues as well, you want to check if they have H-sprung diseases. They're very prone to constipation as well. But if you know that lack of education will not help this child go far, even if medical personnel are not well educated, on how to support children like this with Down syndrome. And also, as they grow, sometimes people call them imbeciles. Sometimes it's because of the behavioral issues they face, and they kind of exhibit. And it sometimes simply means that they're not able to control their impulses. So you want to look at behavioral management. You want to look at mental health care for them. You want to check about their sleep behaviors. You want to check if they are having what you call sleep apnea. If they have sleep apnea, they need to see the ENT. They need to be checked. They need to be monitored. Then also the endocrine system as well needs to be checked. And of course, the tilt, there's so much I want to mention, but the reality is that I've not even started talking about educating children with Down syndrome. I'm just talking about the care. And then from birth, they need intervention, especially when it is very, very clear that this is a case of a child with Down syndrome, and that it's not about people saying, okay, I'm not sure, or maybe the parents living in denial. And yeah, I mean, it's okay to try to process the news. It's called the grieving process. And the only thing I know that actually will not help parents like recover fast is because there is no support, like from the from medical personnel, like social workers, therapies. And then the cost of having all of this professionals work with your child is also very alarming. Cost a leg and an arm and a leg. Sorry about that. And you see, this is something that is supposed to be free, like it's free in other countries. So that is very, very very common around. You don't get support, the kind of support you need. And that is why we started Moyoluwa Rainbow Down Syndrome Foundation, to help families from birth, because there's so much you need to help the child to overcome. It's not like it's magic, but I mean, all of this will help the child to withdraw from using compensatory means to be able to cope with whatever milestone they're actually attaining at that moment. Then come to talk of respiratory as well. Then well, I'm not going to take too much of your time, but let me quickly just talk about administering support. You need to help the child, with feeding skills, fine motor skills, develop gross motor skills, then work on the muscles, help the child to at least early intervention. I know definitely is between the ages of 0 to 3, but the Nigerian reality is such that between the ages of 0 to 3, parents are still living in denial. Between the ages of 0 to 3, they are trying to cure Down syndrome. They're trying to wish it away. I'm not saying all parents now. I'm just saying, well, because of the level of education that that some people don't understand what Down syndrome is already, so they're trying to find a solution or trying to cure it. That's what I was trying to say. So when I say parents, I'm not saying every parent, so that I don't get misquoted. Yeah, because I know that children with Down syndrome are very amazing, just like every other child, and parents do love their children. But not being able to cope with that condition is what I'm actually trying to say, and that is because there is no support, not enough help, and not enough education. And then the early intervention goes from 0 to 3, and then you see that a child with Down syndrome, I've never been to a setting where there is a form of intervention between those ages. Then what happens by the time the child is 4, then parents begin to cry for help, find help, find solutions, and sometimes they get into the hands of quacks that will tell them this can be cured, this can be the facial appearances can disappear. Then they will try all sort of herbs, all sort of treatments, because you cannot change the genes. It is a chromosomal disorder. It is one of the most commonest chromosomal disorders when it comes to syndromes. So, this is the presence of an extra chromosome in all of the cells, or parts of the 21st chromosome in some of the cells. And then you're trying to change the genes, and this is not going to work, because what you fail to do is you fail to take the person as a human being before the diagnosis. So you want to treat that child with a lot of love. You want to do the best you can for the child. You want to find your support system. You want to join support groups. And most times, a lot of times, you see parents still living in denial even after the child is 3. And then I usually have this weekly talk show named titled "My Child Has Down Syndrome, So What?" So we've been treating various topics, and the very interesting one we treated on Sunday was, can I get pregnant again? Please, you can go to Instagram, follow Talk to Tola Makinde to watch it, and I'll try to see how we can also upload it on YouTube. But it's so interesting, very interesting, because when a child is born with Down syndrome, the child is dealing with so much, like, it's already like an error during meiosis. So it's not what you want to like take away, or while the child is pregnant, remove that extra genetic material or remove whatever is going to cause you to have that child with Down syndrome. Once the error is it happens during meiosis, then you have this child, then what you do after is what matters. So when the child is like 4 years old, what are the areas where you can help the child? Like I said, there is no support in the Nigerian system. But what the child needs is also to check if the child can get an assessment done, by professionals, which includes speech therapists, developmental pediatricians, occupational therapists, physiotherapists, social workers, maybe psychologists if possible. Then you want to check, as the child is growing, what are the issues, the challenges the child is having, or what are the strengths the child possess, because then you want to leverage on the strengths and then help the child to develop skills, self-help skills, very important self-help skills. And then when you have professionals working with your child, you also must come on board as a parent. You must come on board as a first advocate, as also the child's first therapist, because it's like a partnership. That's the way it should work. But we rarely see that happen in Nigeria. For me, I had to resign from my 11 years, career, my job, and that's because I had known about the care, for children with Down syndrome, and I realized that if I'm absent, this child will not get the burst, or the child will not get early intervention, which is very, very key. I want to kind of wrap up now by saying that in Nigeria, there isn't priority for persons with special needs, for children born with special needs. We hope that the government can see, the light, and, tap into, this disability space and begin to do what we wish, should be done. We're not asking for too much. We just want the government to find a way to make the community more inclusive, to make support available, access to good health, access to all these tests I mentioned cost a lot of money. Even the karyotyping, which is a test that that helps you to determine the type of Down syndrome your child has. Like I said, we have the translocation, the non-disjunction, and the mosaic types of Down syndrome. These tests are very expensive, and not only that, even the prenatal test cost a lot as well. So we need subsidy, we need easy access to all of those tests, and even echocardiogram, which helps you check the heart condition of the baby with Down syndrome, and name it. So this definitely needs funding, and it should be in the plan of the Nigerian government to help save our children born with Down syndrome. Thank you. I hope you learned one or two things. If you did, then you can reach out to me. Let me have your feedbacks so that we can, keep sharing, keep talking, and keep saving children born with Down syndrome. Thank you very much. Bye.